It's quite a challenge to give you a summary, a little précis of what this conversation includes with Jillann. She draws the contrast between her medical life, her medical world, and the wider world a number of times in the conversation, talking about her experiences as a student representative at university, not just for medical students, but for all of the faculty. She draws the contrast between working for the UN based in New York in the wider world with a wider world lens perspective than when we might just be working in our own home country. And she has a very healthy respect for learning beyond medicine. She's about to do the Australian Institute of Company Directors course. She's choosing the mainstream route rather than the health specific route because her past experience has taught her that she'll have a wider learning experience and learn new things if she can step outside of what she already knows. Jillann maybe wasn't a systems thinker at the beginning. She certainly is now. She has that depth of wisdom and experience that I think people get when they've been testing their ideas for a long time, to be able to step into that very human, one-on-one, face-to-face experience, and then to step back out onto that sort of big global thinking. I think she's a terrific role model for all of us in noticing where our perspective is and in noticing that we might take a different perspective, that there are other perspectives worth being curious about. We talked quite a lot about the culture of perfection that exists in medicine. Jillann reminded us that perfection can be very good when it encourages striving. It can also be bad when it discourages us from stepping up. We talked about opportunity and how to see opportunity and to step up and do things differently or outside of what we might have naturally expected and the benefits that that can bring. And we talked about intersectional disadvantage. This particularly could have been the whole podcast. Jillann has some very useful insights, I think, into understanding intersectional disadvantage and privilege, and she in particular pointed to this concerning idea that people say they're colorblind. Jillann reminds us that being colorblind is not a kindness, and she describes it as this is a stubborn denial of intersectional disadvantage, and that those with privilege need to be working to help remove the barriers that some people experience and others do not experience. I hope you enjoyed this conversation. I want to just let you get on to hearing Jillann, and I look forward to your feedback as you soak up the wisdom and the experience of an Australian doctor with a very global experience and perspective. Hello and welcome to Recalibrating with me, Sharee Johnson, where you'll hear healthcare professionals and others sharing their stories of recalibrating life when the unexpected happened. Life is full of opportunities to recalibrate with agency, the right mindset, the right resources, and the right community. Dr. Farmer was the medical director of the United Nations at the headquarters in New York for 8 years. During her tenure at the UN, she was responsible for the health, safety, and well-being of all of the UN personnel deployed throughout the world, and she was also responsible for the standards in healthcare facilities that were operating under the UN flag. Dr. Farmer managed the UN's response to the New York wave of COVID-19 in 2020. Since leaving the UN, she has worked as a Deputy Director General in Queensland Health and as a frontline GP in primary care and a rural generalist in emergency medicine. Prior to serving in the UN, she was the Medical Director of the Patient Safety Centre in Queensland Health and the inaugural Director of the Clinician Performance Support Service. From 2023, Jillann has been the Chief Executive Officer of A Better Culture, a project to shift the culture of medical practice to one of respect, inclusion and equity. She is currently a member of the board of the Australian College of Rural and Remote Medicine, known as ACRM to many of us. Outside of work, Jillann has been a martial arts practitioner for 30 years and is a keen hiker, kayaker, cyclist and cross-country skier. In fact, the first time I had the privilege to be on the stage with Jillann, she arrived at that event in a different state to where her home is with her fold-up bike that she had brought on the plane with her so she could get around when she got there. It's my absolute privilege to introduce to you Dr. Jillann Farmer and to talk with her about a wide-ranging, deep-ranging set of ideas. Jillann, thank you for coming here today. After all of that bio, you have some idea. Jillann has so much breadth and depth in medicine in Australia and in the world. We're so lucky to have her here. Welcome, Dr. Jillann Farmer, to Recalibrating with Sharee Johnson.
Thanks, Sharee. It's a pleasure to be here.
It's really lovely to see you. I haven't seen you for a couple of years, and a lot is always going on, isn't it?
Yeah, it certainly is. And whilst the big project I was working on, A Better Culture, sort of dropped from very high profile public view, the work continues, and I'll be happy to talk about that if it's something that we walk across.
Yes, I'm very much looking forward to doing that. But before we go there, you work as a rural generalist in
hmm
emergency medicine in Queensland. It doesn't really capture all the things that you're interested in. Can you tell us a little bit about, what your work looks like, say an average month at the moment in 2026 for Dr. Farmer?
Yep. At the moment, I'm sort of anchored in clinical work, and the reason that I'm doing that, and it is something that I feel very privileged to do, is because it actually just gives me profound joy. I love clinical work. It's something that I have always loved, and even when I stepped out of clinical work to into medical administration or system leadership roles, I used to find that I really missed patient contact, and I was of the view that we need people in healthcare leadership who miss patient contact, for whom, the beating heart, the reason of why they're there is to try and make things better for the people who need healthcare services. So it has been a really joyful experience to return to that. And I started off working in metro general practice, but as had happened to me previously in GP roles, I found the challenge of delivering, true continuity of care and being there consistently for patients was a bit too hard with all of the other commitments that I have. You asked about a typical month. So I am working in a emergency department in an MM3 area, so it's not super rural. But I'm also doing a lot of conferences at the moment, and I'm also trying to help grow the next generation of conference speakers, so sometimes supporting behind the scenes. I do a little bit of mentoring. I've just set up my own consulting business, which I describe as more of a hobby with an ABN at the moment than, a truly going concern. But I realized a lot of people were asking me to do things, and I didn't have a vehicle through which I could convert that to something that justified the amount of time required. I'm doing a bit more work on A Better Culture, which is very exciting. The Commonwealth funding for that project ran out on the 30th of June last year, but the College of Medical Administrators, who had hosted the program, really didn't want the work to just die on the vine, and so they have maintained a trickle of funding to allow me to develop a few projects within that. And we're hopeful that very soon we'll have some very concrete products that we'll be able to put out. I can't forecast at the moment because some of them are still subject to fairly sensitive discussions with partners. But A Better Culture is not dead. I've been describing it as on life support, soon to be breathing on its own again, we hope.
Coming out of ICU back onto the ward.
Yeah,
Fantastic.
exactly.
Before you were involved in these kind of big organizational viewing projects and Better Culture, you were managing lots of volunteer health people from all across
Mm.
the system. It really was a huge project. But as we heard in the bio, you looked after New York during COVID in 2020 in the first wave. I mean, my mind's kind of boggling a bit about how you keep across the fast pace of something like that. Can you share a little bit of that experience of being in the UN in 2020 and managing?
Yeah, so I guess that was the capstone of my UN work, and that was done in an environment where I had um, deep and wide networks. So I had a whole lot of people I could call on, and I already had the trust of the people who needed to trust me. And that's where I think I had an advantage over some of the public health colleagues who were working with the broader population in the US. One of the things that I realized quite quickly after I moved to New York in 2012, just a few weeks before Hurricane Sandy. And the hurricane notices were coming out, and they were telling us that it was going to be terrible. And I was really shocked by the amount of cynicism and disbelief in the population. People didn't believe their government when they said that there was an emergency coming. And I was so accustomed to Australia, where our government puts out an emergency notice, we believe them and we act on it. And so I was working in an environment in COVID where trust had been built over a series of, increasingly challenging events. The biggest one had been the West African Ebola outbreak and the work that I had done there. But in COVID in New York, the situation evolved very, very rapidly. New York became the epicenter. I remember for several weeks watching my colleagues in Rome, because Rome had started off as one of the biggest capital cities to be affected. And I was also, regularly in contact with Chinese colleagues and members of the diplomatic community from China in New York. And, exercising what solidarity with them I could as their family members were affected. And then suddenly it hit us in New York. And one of my colleagues at that time is Penny Abu-Wardena. She was the New York City Commissioner for International Affairs, and she's got a book coming out shortly in which she describes our first conversation when we knew how bad it was. And for me, that moment was when the first confirmed cases were reported in the UN International School. The UN had a school for all of the expats. And we knew by then that it had, an unprecedented level of, for anything that we had dealt with, ability to spread. And we had a confirmed case in Eunice, the UN school. And so I rang the New York City Commissioner and notified her that that had happened and that we could expect, very rapid escalation and spread. And that is exactly what happened. I don't think I was the first signal she received that this was going on, but it was one of the very early signals. And then the next thing was when the public health authorities in New York City stopped contact tracing. They were utterly overwhelmed in terms of their ability to contact trace and try and contain. And then it became just mitigate. And I had to help the UN to make some, several really key decisions. As the medical director, there were some things that I was responsible for making an absolute decision for, but there were some things where I was an advisor to senior decision makers. And the first really critical decision, and I remember it so clearly because it was the first time I had felt in that context the weight of my advice and my decisions, was the cancellation of the face-to-face meetings of the Commission on the Status of Women, which was due to meet in New York. And we went through a whole pile of risk assessment and, looking at where delegates would be coming from, how they would be mingling, what the civil society representatives there would be. There was going to be a very large proportion of people who were vulnerable because of the nature of that work of representation from civil society. And I remember sitting in a room with the chef de cabinet, who is the Secretary General's basically chief operations officer, and giving her all of this advice. And then she just said, well, that's it. I'm making the decision. We have to cancel CSW. And that was my my heart just I almost felt like it snapped in two because it was such an important meeting that so many people had been working towards. But the potential harm was just going to be beyond belief if we had allowed that to go on. And then bit by bit, the gravity of that situation increased until I gave the advice to the Secretary General that we needed to close the UN headquarters. And that was something that I was trying to manage in lockstep with the City of New York, because by that stage already, even at that very early stage, conspiracy theories were starting to abound. And I didn't want the UN headquarters to close ahead of signalling to the broader New York community by their own authorities that the situation was serious. If we had done that, I think it would have been really damaging. And so we were trying very hard to be a combination of, good citizens in our host country versus exercising our obligations to protect the people that we worked with. So it was fast, it was hectic, but I had a little trick that I used every day, and I learned it during Ebola, which was in amongst the crazy. Every morning, there was a little pause when I swiped my card at the entry gates to the UN. There was a tiny delay before the gates would open, and that was my breath. One breath. I had a moment to just stop, breathe, and then just step into whatever the day would throw at me. And I remember that so clearly because it just became a little ritual. Stop, breathe, and step through.
And it was very intentional, obviously. You were doing it on purpose.
Yes, very much so.
This is a little piece of gold right here, as you obviously know, it was gold in your own life. But this idea that we can be really present or mindful or choose our own self, even if it's only for a second or 2 seconds,
Yes.
it's so grounding in place and in purpose and it just in ourself. Who I am. I'm a real living person under a lot of stress in this moment, but I can take care of myself with this one breath. It's very
One
powerful.
breath. And it was, every day I was amazed at the difference that that one breath made. And it
Mm.
felt a bit silly that that was all I was carving out was one breath. But it, it made a big difference to me.
Obviously made a huge difference. And was there other times through the day? Did you notice that that became a thing at other times, albeit random, perhaps not ritual and regular like that? But were you conscious of taking a breath already or other times?
Usually, when I was, the situation was evolving so fast that I stopped preparing slide decks. And I started just whenever I had to present because I was sometimes, and my deputy and I had a fabulous deputy there, who went on to become the successor, the director himself. But he and I were sometimes participating in 3 or 4 meetings at once. We would have a bank of computers across our desks and be zipping between meetings providing advice. It was just the workload was crazy. And so I just started live beaming the data direct from the Johns Hopkins Public Health website. And I do remember each time I had to do that, that was another moment for a breath. I was like, here we go. How are they going to take this?
Yeah. Does it seem unreal now? Is there any part of you that feels like this seems like another life or a parallel existence?
Um, I don't no, not really. It was a different stage. And it was, best job ever. I still can't believe I had an opportunity to do that. And I left intentionally for, very well considered reasons, but it became part of who I am. So it doesn't feel like
Mm.
another life or a separate thing. It ended up woven into my DNA.
I think that some of the people listening to our conversation would think this is just wild. How does a GP from Queensland get to be the medical director of the UN for 8 years during these massive crises? You know, Ebola and COVID and hurricanes. I mean, you don't come from hurricane country.
Oh, I come from cyclone country
Yeah.
though.
Yeah. Is there enough similarity? I mean, I don't come from either of those places.
Yeah, there is. They're very similar. They're very, very similar. I think they're actually the same weather phenomenon, just different names in different parts of the world.
Mhm.
But the difference for me was my, in that very early bit, was my just that vast difference in community response. My head was full of the images of Hurricane Katrina and how law and order had broken down. I found that the level of sort of like ride it out advice that was being given to the American public was not commensurate with all of the education we receive in Queensland about that. So I had measures in place. Like I was ready for things to shut down for 4 or 5 days because I just thought, okay, I'm just going to go into cyclone mode here. And I did. So I did all of the things that I normally would do to prepare my home in Queensland for a cyclone, and I prepared my tiny New York apartment as best I could,
Mhm.
including tape on windows and things like that, moving stuff away and putting
What?
lots and lots and lots of Ziploc bags of water in the freezer instead of going out and panic buying bottled water. So I was well prepared.
Wow.
Not for Ebola and not for COVID, but I grew into those roles.
Yes. What's your reflection culturally and the cultural difference that you experienced to go and work in America and the expectations you had that some transferred, some didn't to that culture? What's your reflection when you come back to Australia and we have medical people from all around the world
We
work.
certainly do.
Yeah.
So I have many reflections on that. So the first one was that one of my colleagues, who had lived and worked in the US for a while, sort of gave me a little bit of a forecasting shot. And she said, just be ready for the US to be very culturally different from Australia. We all think that we're culturally alike because we have so much US culture coming across our televisions. And so we think that we're very similar. But Americans are culturally very, very different from Australians. And my first hint of that was the level of mistrust in government around the hurricane. But to be clear, I never worked in the United States. I
Mm.
worked in
No.
international territory.
Mm.
Um, but I had lots of contact with doctors and other health professionals in New York, both through preparedness and through my own need to seek healthcare. The thing that I've always felt that I had an easier job than other directors in the UN, because it is a huge challenge bringing together a team from every corner of the globe. And one of the things that I miss was wandering down the halls of the UN Medical Service, and in the space of 50 meters in a hallway, I could hear 4 or 5 different languages being spoken, and it was lovely. I really enjoyed that, and I loved that people could collaborate with colleagues in the language that they chose and flip back and forth seamlessly between. I was always envious of their ability to do that. But my job was easier than some other directors because medical culture seemed to be the ties that bound us. And we could always return to our desire to help, our desire to, minimize harm, promote health. There were some core values of being health professionals that allowed me, in some regards, to transcend what cultural differences there may have been because of ethnicity, language, religion, or geography.
Mm, mm. It's very tempting to just zoom forward. It's so interesting. I just wonder if we can go back briefly.
Mm.
Before you went to the UN, you were involved in safety and some other kind of
Yeah.
what global considering roles, let's call it, or bigger system considering roles
Yep.
at Queensland Health. Can you tell us a little bit about, I guess, what your interest was in safety, how that came about? Because that's again a step outside of the what people might imagine a GP does in their room with their patient. Maybe
Yep.
you just walk us through a little bit about how that evolved in you, because it seems like that was a part of the steps towards the
It
UN.
definitely was. It definitely was. But the story actually goes back way even before I was a GP. At least this is my assessment of what shaped me in that direction. Um, I was a first year medical student at UQ, and I had a friend who was really struggling. He was pretty confident he was going to be kicked out. And
Mhm.
he thought that if he got elected into the student union, that he would be less likely to be kicked out. So he wanted to run, to stand for a medical representative on the Student Union Council. But he didn't want to do it alone. He wanted a running mate. And I went, yeah, sure, put my name on the posters. That's fine. And so we had no money, no backing, no nothing. And we ran a little campaign with a little hand, I hand painted the posters. And, we had this campaign slogan, one Fred, two Jillann, or whatever. I'm not going to name my former colleague. And he was a weightlifter, and he was a very big, beefy weightlifter. And partway through the campaign, after the nominations had closed and everything, he decided to withdraw. And he started walking around lecture theatres saying to people, to all the medical lecture theatres, vote for her or I'll rip your bloody arms off.
Oh my God.
And that was how I got elected to the student union. And then Mike took me under his wing, and I started learning how the student system worked. Mike was at that time the education vice president who supported student appeals, and I then succeeded him into that role. I became the education vice president of UQ Union in my third year. So I was the med rep in second year, education vice president in third year. And in that period, in the EVP role, I was dealing with a lot of students who needed advocacy around academic exclusion. And then the opportunity came to stand and be elected president of UQ. And I did that, and I was. And so that was for me one of those sliding doors moments where my whole perspective on medicine and systems and people changed, because I stepped out of the very homogeneous culture of the medical school into an environment where people were performing at an incredibly high level, because I was suddenly sitting on the university senate and the academic board, and I got to see and I got to see how systems worked. I actually got to see how systems could exclude people with disability. I got to see how people with, like I was representing and advocating for medical students who were recovering from mental health conditions and arguing tooth and nail with the dean to get them back in. And I saw then as well how different the approach of the Faculty of Medicine was to the approach of the other deans. And that really got under my skin. And so I then left and, transitioned, and went back into med school. Interestingly, my grades went up by a whole GPA point because I think I learned to learn fast while I was surfing student politics. But I went through and graduated, but I was a rural scholarship holder. So I went around a few different places, and I think that's when my passion for patient safety really got ignited, where I could see that, and this was Queensland before credentialing, before scope of practice, and I got to see some really unsafe practitioners who were unchecked, unfettered. And there were times when literally it was me at PGY 1.5 was standing between a consultant and a patient to prevent harm. And that just wasn't right. It shouldn't have been the case. I had backup from some other senior staff who, for whom I retain lifelong gratitude. They used to even let me switch bed cards so that we could keep patients safe. And it was a really formative period. And then after that, eventually, it all sort of came together. I knuckled down and got my GP fellowship because I kind of thought I couldn't mooch around doing nothing, with formal qualifications forever. And then once I got my GP fellowship, I applied for a job with the medical board, in the complaints space. And I didn't get that, but they asked me if I would step into a role under what was then called impairments. And I had never done anything like that before, but it ticked a few of the boxes that had formed during my student union period. And so I set about reforming how the medical board dealt with doctors who were struggling with substance abuse or mental health challenges. And I think I made a difference. So I did that for a while, and then I went to Medicare, and then I ended up with just a cold call when I was sitting in the car park waiting for a different job interview. Would you come and be a director of medical services at this little facility? And I did that. And from there, patient safety, and then off to the UN. That's the CV in a nutshell. So they all look very logical now in retrospect. It never felt intentional. It never felt like I was creating path. I just chased the things that I thought would be interesting and that fed that part of me that wanted to make a difference.
It sounds like, Jillian, that actually some of these accidental things that happen at the start, or things that happen purely because you were open or curious or willing, a willing friend, that you discovered some parts of yourself that you didn't necessarily
Absolutely.
know were
Yeah.
sitting
I
there.
mean, I'd
Did you
always been a rabble rouser. I think I led the student rebellion in year 10. So
So there was a personality streak here, but did you grow up rurally?
I grew up in Rockhampton.
There's such strong values coming through here that are evident today as well. And it's a formative time, those late teens and those early
Mm.
20s where we separate some of our values are different from our parents. We evolve, if you like, at that period of development. Do you feel like you were honoring your values, and or the values were shifting or changing because of your experience? It seems to me both of those things were probably
I think that I really do need to acknowledge the contribution of my parents, especially my mother.
Mm,
And, even though there's many things in the Catholic Church that I don't agree with, I had the privilege of a Catholic girls' school education. And whatever you may think of Catholic nuns, and even if they may not badge themselves the same, they were fierce feminists.
mm,
And they contributed to the ethos, from my mum, especially, that there was no challenge I couldn't rise to. That really was the you can do anything ethos. And I know that not everybody in a Catholic school has that experience. That was my privilege as an academically gifted, and white middle class kid. It's not the same for everyone. But the Sisters of Mercy, all the way through education, it was about that you have an obligation to use what you have for the benefit of other people, not just for yourself. And that was definitely something that I internalized, and I continue to feel that way, that it shouldn't just be about enriching yourself. It should be about, it's not bad to become economically viable as a result of your talents and skills. But if that's the only thing, I think you end up a bit hollowed out.
mm,
Um, and so there was that. But the area in which I deviated most, probably from my parents, was, my realization didn't come until I moved to New York and was working in the UN. And I had, a moment of realizing that my head was full of a whole pile of racist, well-intentioned, but racist assumptions. And I
mm,
remember it very, very clearly when, I had that moment when I was reflecting, and it was like, oh my goodness, that's really, really off. And it was, it was not that my parents or even the culture I grew up in was rabidly hateful towards people of other races, but there was just a quiet assumption that they really weren't terribly capable of doing very well and that, poor things, that's the best they can do. And I carried that trope into my very early work at the UN, and I remember it very clearly. I had been out in one of the peacekeeping missions inspecting a field hospital, and it was really not up to standard. It was way below standard. And the doctors who were working there, from a country that I will not name, they were incredibly proud of what they were presenting to me. And I remembered not wanting to challenge them about that because this thing in my head was, oh, the poor things, this is probably as good as they can do. And I went away and thought about that, and I realized that that was completely the wrong mindset, because what I needed to do was recognize that these colleagues were every bit as intelligent as I was, had every amount of potential that I had, but there were barriers that we needed to remove for them so that they could fly. And so the dialogue then became around what is it that we can do to equalise this playing field. And from that spawned an enormous body of work, which I'm very proud of. When I entered the UN, we did not have any documented auditable standards for healthcare facilities. And
Wow.
so I brokered a partnership with Joint Commission International and set up a team, and there are now UN standards and they're auditable. And so now governments who want to send their doctors into the field know that they have to be adequately equipped and they have to be adequately trained. And those standards are one of the artifacts that I'm very proud to have left behind.
Mm. Well, it's got to create more safety for the doctors for a start, and therefore
Absolutely.
patients
Yeah.
and the rest of the team. I want to pause. I think there's so many examples here of recalibration, and you've just given a beautiful example of self-awareness and the mindset, and we'll go there in a little bit about how important in leadership self-awareness and mindset and being able to shift our mindset is. But before we go there, what have you learned in all these things you've told us about so far about recalibrating? What are the skills or the resources or the people that help you make those shifts that you've made lots of during your career and in your personal life?
The first thing is that it's a muscle that grows when you use it.
Mm.
I think I started doing that very, very early in life because I went to 7 different primary schools.
Wow.
You know, my dad was a Commonwealth government worker, and we were transferred a
Mm.
lot.
Mm.
And I just kept moving and needing to sort of restart. And I think that was the first set of just rising to challenges and learning and establishing, new networks. That fortunately, my parents stayed still for the entirety of my secondary schooling, and so I didn't have that level of disruption. But then, of course, it was, off to uni and, coming from the country into university. So I think there is a skill set there that, learning to adapt and change and move into different environments. The other thing that we haven't spoken about is I trained extensively in martial arts, and I think that awareness of self and awareness of the impact of emotions on actions is something that I really gained from martial arts. That it is very easy when someone is thumping you to get angry, but it doesn't actually really help you execute the plan that you need to execute. And I do remember having a moment. I had just done my first black belt grading, and I was sitting waiting for a job interview at the medical board, which was my first non-clinical job, my first bit other than the student union presidency. And I was sitting there and I was quite nervous because I really wanted to do something different. And I was sitting there, and it was only a few weeks since I'd done my first black belt grading. And I was sitting there, and I just, for some reason, I had this little thought bubble. I went, hang on a minute, nobody in this room is going to hit me. And it was just like,
I'll be
that's
okay.
amazing. nobody's going to hit me. And I just completely relaxed. And it was just like, yeah. And I think, I've been helping some people to have that sort of transformation in their thinking, even around specialty exams. Some people, in medicine, we are trained over and over and over again that anything other than perfection is completely unacceptable.
Yeah.
But when you look at reality, um, there are many medical exams that are actually what we would call low stakes. They may feel incredibly high stakes because it might be your exit from the training program. But certainly a first attempt is actually a low stakes situation. Nobody's going to die. No one's going to lose a limb or an eye. The sun will come up tomorrow and you'll still have a job.
And you'll get
The
another go
life
if
will,
you need
and
to.
nobody's going to hit you.
Yeah.
Even better.
Fantastic.
So I think it's that thinking about so there's two key things is getting it in perspective about are my emotions running away with me here and making this feel a lot scarier than it is. There's that. And then there is this lovely thing that I think Akram was really the people who enunciated this for the first time, which is clinical courage. And I think it was that clinical courage ethos that I was tapping into at the UN when I was rising to all of these challenges around chemical weapons and exotic viruses and, wartime environments and stuff that I had never been trained to deal with.
Mm,
But recognizing that I might not be the world's best at this, but I am the person who's here and I have to do this and I will do the best I can and it will probably be good enough. And I think that the culture of perfectionism is good if it encourages us to strive. It is bad if it discourages us from stepping up. And
mm,
I think that that clinical courage translated into courage in other aspects of work is a really important thing for us all to carry.
mm. We're such complex beings. I can't help but think that the discipline of martial arts has been really grounding for you too. Just the discipline of it, that the moves have, there are things you can do and things you can't do, and it's as much a
Hmm.
mental practice as it is a physical practice. And so
Yes.
I think these outside of medicine, they don't get enough profile from my mind. I think, people sort of blow off yoga. Actually, any team sport, any martial arts discipline, any practice of going for a walk every morning to start your day, these things all make us steadier, give us more physical confidence in our body,
Yep.
help us have moments to notice what our mind is doing. I just want to kind of savor this
And
for a moment.
it's also to learn that imperfection is okay. And I actually intentionally set about drilling that into myself with music studies. So
Mhm.
I kind of recognized that I was a bit too obsessed with perfection. And so I just intentionally put myself through the very stressful and humiliating experience of studying a musical instrument. And, I am never going to be very good, but I love it. It's fun. And I learned that actually missing a note when you play is not the end of the world. And, that's okay. And so it became for me a place where I could just really mess up without consequence. And that's actually good. That was
Mm.
a really helpful thing. But I also remember I was participating in a classical guitar summer school in the UK. So I went along, and part of this was you get put into an ensemble and you get 4 or 5 days to prepare, and then you perform in a concert. And we had, for some reason, I do not understand why, I got put into this group that was playing an incredibly complex piece of Bach that had been adapted for classical guitar. And we had 4 days to rehearse, and it was a train wreck. It was an absolute train wreck. And we were all sitting in the green room just with our faces on this is a train wreck. This is a train wreck. And our coach slash, conductor who was the arranger who'd prepared it, he said, just trust the music. Just go out there and do your best and you will be fine. And we took our little train wreck out onto the stage, and magically it just all came together. And everybody was saying to us, how did you do that in 4 days? We were all looking at one another going, we don't really know.
And how did you feel? How did you
Oh,
feel?
amazing. Amazing, and it's still one of my favorite pieces of music.
Yeah,
to
so
listen to, not to play.
the risk was worth it, and the effort, the novelty, the hard work was worth it. And there was also a trust in each other at some level there in that.
Yeah, there definitely was. But it was also for me very much about, again, no one's going to die. No
Yeah,
one's going to lose a limb or an eye. The worst that can happen is that I'll be humiliated.
yeah, yeah.
And humiliation, whilst extremely unpleasant, if it's humiliation you choose to bring on yourself, it's not harmful.
Yes, exactly. So now, we're stepping into some of our other topics, but before we get there, I've got this question here. Has medicine asked things of you that you weren't expecting? I think we've covered that. But I wonder, the question is, positive and negative things you weren't expecting and unintended consequences. Have there been, it sounds like, this story is full of unintended consequences that you've been able to embrace and welcome and contribute to. Is that a fair?
Yeah, the UN story is kind of cute because when I was a very little girl, I used to want to work at the UN. I used to read Phantom comics, and Diana worked at the UN, and I thought that's what I want to do. I want to work at the UN. And then at school, we had this book that all the kids coming to school on UN Day in their national costume, and I was really disappointed that my mother couldn't tell me what the national costume of Australia was.
Yes.
So I had this little idea about working at the UN as a kid, and I never expected that to happen. And then when the opportunity came up, it was like, well, got to do this. That's going to be fun.
We were talking before we started about this sense of feeling trapped that medical doctors often have in their mid-career.
Mm.
Is this a good place to reflect on that,
Yeah.
given your experiences?
Yeah, so because it is actually exactly the right place to reflect on it because I was sort of mid-career. I was about 47 years old when I applied for the job at the UN because I really felt like I just didn't have um, like any other challenges that I could step into within Australia. It's like I've done the things that I want to do and it's sort of fun, but it's not really fun anymore. And maybe and then there was an interesting series of events happened that led to the UN job. And one of them was recognizing that I needed a little bit of professional development around the exercise of power. And it's a complicated story that I won't go into. And I found a course at Harvard called Women in Power, and I went off to that. And there were a few women from the UN there. And I just remembered thinking, listening to them participate and engaging with them and thinking, you are not so terribly better than me. I think I could compete for a job in your world. And on the way back home, someone handed me a copy of The Economist with a job ad from the UN in it. So I got a subscription. And at that point, I was ready to leave medical jobs
Mm.
because I didn't even know that the UN had medical jobs. But I knew that I had lots of other skills. And I thought, okay, I'm just going to find some jobs and apply. But then the very first edition that landed in my letterbox had the medical director's job advertised in it, and it just felt like the planets aligning. So I think that willingness to even contemplate something outside of medicine gets you to look in other places and see other things. And the other thing that I have learned is that going to non-medical events is a really important thing to do. I think that medical culture can be very insular, and we can get stuck in our own bubble of pain. And my moment of realization came when I had a gazillion frequent flyer points, and this was even pre my UN days. I had a gazillion frequent flyer points, and they were going to expire, and I had exactly enough points to get a first class flight to Singapore. Great, I'm going to go to Singapore first class. What can I do there? There was a health economics conference on there hosted by The Economist. And I had no background in health economics, no background internationally, but I rocked up to this conference and it was amazing. It blew my mind. All of these people from non-medical backgrounds grappling with the big issues in healthcare, like the health minister from Indonesia talking about how many islands they had to deal with, how many kilometers of coastline they had to be prepared. So just listening to all of that stuff lifted my thinking to a whole new level. And so I think if you're feeling stuck, a really great thing to do is even just venture into some non-medical conferences. And in a couple of weeks, I'm doing the AICD course, and I've intentionally chosen to not do the medical one. I am not doing a healthcare specific AICD course because I want to hang out with the cool kids outside medicine.
Fantastic. I think there's more and more examples of that. Cheryl Martin is another example that comes to mind in terms of doing the Melbourne Business School
Yep.
masters, with non-medical people. I think,
Yep.
this is, I love this. I say this every week to somebody in coaching, that medicine offers so much, but it's a narrow world. It's a small world, and there's so much more beyond that medical skills can be applied to. And so, you're a living, breathing example of that.
Mm.
Thank you. Let's talk about mindset and awareness. A lot of what you're talking about comes, or your reflections at least, even if you didn't know in the moment, your reflections are that you can look back and see what was happening in my mind and how did that change my
Mm.
behavior. I was going to say maybe this is more relevant to trainees who are on the train tracks of medicine getting their qualifications, but I think this is relevant all through medicine where people get on a train track and maybe they're not doing that meta thinking, that noticing what they're doing and how they're limiting themselves. Do you have any, I'm going to call it advice, to give people about how to do that, how to practice noticing what your own mind is telling you that may or may not be true?
Yeah. In fact, I used to teach this. I used to train open disclosure facilitators, and
Mhm.
that metacognition is actually a really important skill, learning to think about thinking.
Yeah.
And what am I feeling? What am I thinking? And you're right. I think it's unrealistic to expect people to be doing it in the moment. Um, Something we haven't talked about is my other specialty, which is medical administration. So in between the hospital job and the patient safety centred job, I completed my fellowship in medical administration. And like many trainees, every time they would ask me to write a reflective piece, I would roll my eyes and and I remember saying to one of my colleagues, if I have to do much more reflecting, I'm going to turn into a disco ball. Just,
Thank
but
you.
credit where it's due, it's a very powerful tool. And so I think I don't want to be turning people into disco balls. And I think if it becomes burdensome, you become aversive to the practice. But I do think that where you have a thing that whatever the thing is that's happened, be it an interaction with a patient or with a colleague or a clinical scenario, or there are things that stick in your head. And there's a difference between ruminating and reflecting. And I think it's very important. And for me, the trigger is if I find myself ruminating, that is a key trigger that I need to reflect on what was happening. What was I thinking? What was I doing? What do I recall of my physical, visceral responses? What else was happening in the room? And I think that that moment to think about yourself and reflect on what are the things that I can learn from this can help transform what can become a cycle of negative rumination into a stepping stone forward to improvement. And that's definitely been something that I picked up along the way. And I think the foundation's definitely in martial arts. You know, you get smacked in the face, you're going to learn that there was something wrong with your technique. And that's a very immediate bit of feedback. But you learn to analyze yourself. And I think another very important learning for me was when I stepped into having my own karate school. I noticed one day that my students were all fighting with their chins stuck out, and I couldn't work out where it was coming from. And then one day I saw myself in the mirror and I was doing that, and they were all copying me. And so that was again, it was a literal reflection.
Yes,
I saw
indeed.
myself in the mirror. So it was a chance to recognize as well that that the behaviors of people around us might be more influenced by our own behaviors than we recognize. So those moments to stop and think, what am I seeing? What am I doing? What am I saying? What's hooking my head? What's eliciting a limbic response from me? Those things are very important parts of understanding who you are and understanding how you work. And in that lies the key to working out what will make you happy.
Yeah. And you're reminding me back to the one moment at the UN gates with your
Yeah.
card, that these reflections and these learnings don't happen when everything is full and it's fast paced and there's lots of pressure. They happen when we're in the shower, they happen when we go for a walk, we happen in the moment that we take a pause and we notice in the mirror, oh, I've got my chin stuck out too. So we need actually space. It doesn't have to be huge amounts of space, although sometimes we do. If people are feeling burnt out or really struggling or feeling really stuck and trapped, they probably do need a bigger space than a second or two every day. But these
Yeah.
these spaces is where we actually discover or see or notice these choices. I think the problem about pressure and fast pace is we forget our choices. And the other image that's coming to my mind is you with your bank of computers at the UN and thinking, how the heck did you maintain any sense of I've got a choice in this? Do you have a sense looking back that you did remain, did you have enough practice and habit by then to still have access to your metacognition in those moments?
Oh, very much so. Like my deputy and I were we were laughing about how insane this was. It was just like, this is crazy. This is absolutely nuts. But this too will pass.
Do you think it was important to have a trusted other person there
Oh
that you
God, yes. Bernhardt
helping
and
each
I
other
were an
through?
A-frame.
Yeah.
We leaned on one another. And in fact, one of our practices that continued through the crazy was that every day, unless one of us wasn't in the office, we would sit at 11:30 before it got busy, we would have our lunch together every
Mm,
day.
mm,
And that was a really important time of support for both of us because there were really within the UN system, my first big learning was that health is an overhead here. It's not the main game. And so
mm,
that was a big recalibration for me
yeah.
to come to terms with the fact that some of the stuff that I was promoting wouldn't be the highest priority for the people I was promoting it to. So Bernhardt was a really key support and sounding board.
Mm,
And that moment together, even if it was only 15 to 20 minutes, we would always take lunch.
mm.
And that's, you have to
You're,
eat and we may
yeah,
as well make it useful.
yeah, you're again showing us, Gillian, how important this pause is. You need to prioritize it. Somebody's got to prioritize it, and it can be you.
That's exactly right. Because
If
no
you
one
have a
else
colleague.
would do that. No one else would prioritize
Yeah.
that. And, I had sort of a rule of thumb that the only thing I would have aborted my lunch for was a cardiac arrest, really.
Mm, mm.
Other than that, 20 minutes is not going to kill anybody.
I just feel like we're having a moment of really serious leadership here. I was talking with a emergency doctor last week who makes a priority of having food every single shift and modeling it and insisting that the trainees or
Mm.
the doctors have some food every shift. And I said to that doctor, this is such a gift that you're giving the people around you as well as yourself to be so consistently prioritizing that this must happen, even if it's only for 15 minutes.
Mhm.
It's not
Absolutely.
negotiable. Yeah. Let's move because there's lots more things to talk about. So let's get to a better culture. I think that's a really important piece of work that's been happening, and as you told us at the beginning, continues to happen. So maybe for the people who've never heard of a better culture, certainly our non-doctor audience or our doctor audience beyond Australia won't know what we're talking about. So can you just give us a short version of what that is,
Sure.
and give us the update about where we're going and how
So,
it's evolving?
a better culture it was a Commonwealth funded, so funded by our national government in Australia, a project that was developed in response to a thing called the Medical Training Survey. And the Medical Training Survey is a nationwide survey of early career doctors who are before or during their enrolment and completion of a specialist training program. So we have a couple of years where people are what we call pre-vocational. They haven't really siphoned off into a training program. For some people, that period extends anywhere up to 5 or 6 years whilst they complete non-accredited jobs and eventually get onto a training program. So the MTS captures all of those people before they get a specialist ticket. And the results of that survey, year after year after year, were showing very high levels of reported bullying, harassment, racism, and discrimination. And so the Commonwealth partnered with RACMA, the College of Medical Administrators, which I mentioned earlier as my other specialty, to develop, to implement a project. And the key remit of the project was to design an agreed approach that could address these year-on-year findings. So, a better culture was born. Originally, it was called the culture of medicine, but I didn't feel that that was appropriate because doctors operate in ecosystems and it's not, I felt that that was pejorative and it was blaming the medical part of the healthcare system for something that's clearly a system-wide issue. You look at the data from nurses as well, and their experiences are as bad, if not worse, than doctors. I talked earlier about how doctors can get stuck in their own little bubble. And my student union experience taught me this, that things are very different, but they can be equally as bad for people outside medicine. And I feel doctors have an obligation to advocate not just for ourselves, but for everybody. So we changed the name of the project and the branding and everything away from the culture of medicine to a better culture, seeking to broaden its impact and make it clear that what was needed was an evolution of culture in healthcare, full stop. The project ran for 2.5 years. We managed to stretch our 2 years of funding out to 2.5 years and developed a number of key artifacts throughout the project. The final two of the formal project, there was a report about the whole project with a series of recommendations to all levels of the healthcare system, from the federal health ministers, directors general of the jurisdictions, training colleges, and local managers, the entire sweep. And then there was a second report that was authored by the First Nations medical officer in our team and a First Nations committee on cultural safety and cultural governance. So those two reports were the capstone outputs, but the project then did not implement any funding at all for implementation. So RACMA have kept me on throughout the last year on a an ad hoc basis to continue to funding grants, progress some of the work, and we've got a couple of things now getting very close to fruition, which I can't really talk about yet because they are still subject to negotiation. But we are hopeful that the incredibly hard work that our hundreds of volunteers put in to develop the intellect behind a better culture, that we can now translate some of those things into very tangible products that will be applicable in the Australian healthcare sector. So we might not have the immediate uptake that we had hoped for, but I certainly learned at the UN to play the long game. And I learned in martial arts that if one punch doesn't knock your opponent out, you just need to find somewhere softer. So we're just continuing to look for spots that we can leverage the learning and the incredible output that people
Mm.
gave us.
And the measures that you're interested in, Gillian, they're principally around those four things: discrimination, bullying, harassment. That's what you're measuring.
So that is the de facto measure,
Yeah.
because that's what we were set up to address. So that was always the key goal. They are going to be really difficult to shift, and I think that the idea that a project to address that after it had been rigid for years, to set it up with a 2 year horizon, was never going to address the problem. And I was very clear about that from the beginning, that we're not going to fix it. We will give you the signposting of how to fix it after 2 years, and it will be a solid, very well developed piece of work, but we won't fix it.
And I want to go back to that time. I remember talking to you at a conference and saying, 2 years, what can anyone do with 2 years, kind of thing. And to just acknowledge your long game, your optimism about that, well, something has to happen and we need to start somewhere.
Yeah.
These numbers are not okay and they can't stay that way. And I know that lots of people talk about equality, and I think that you talk much more about equity. Can you help our people think about that a little bit? I think that's a really important thing for us to get really clear about.
Yeah. So equity and equality. So I'm not the great expert, but I think if you think back to my story about visiting the field hospital and realizing that what I needed to do was address the barriers that were stopping these colleagues from another country performing to the full limit of their potential. That's really the best example I can give you of an equity lens. So the other thing that I bring into this then is the concept of intersectional disadvantage. So it took me a while to come to terms, and this is very much shaped by my experiences outside the UN, but in the US, where I had opportunity to engage with a number of incredibly erudite African American leaders. One of my connections was the first Black American woman to ever make it on to the presidential ballot in every state, and I had another friend who spent many hours as I wandered through Central Park birding with him, sort of educating me about race and politics. What I learned there is that when white women step into advocacy about women, they risk marginalising other groups. And the best model for overcoming that is to learn to think about intersectional privilege and intersectional disadvantage, which means that any one individual brings all elements of themselves to their world. And that might be race, gender, education level, body habitus, income, citizenship, primary language, multiple different things that intersect to put you in a position of privilege or not. And I think if you have never considered equity through an intersectional lens, then it's kind of the difference between a 2D black and white movie versus a 3D full color IMAX experience. Once you understand or have even reflected on your own intersectional privilege, it becomes a lot easier to think about what can we do to lift others up. And that's where I loop back after that detour into equity is about addressing the barriers that stop people from being able to reach the fullness of what they should be able to. And there's a beautiful diagram that I'm sure many of your viewers will have seen, which is of the three kids trying to watch the footy match
Yeah.
and the different levels of boxes underneath them. But ultimately, removing the fence so that they don't need boxes at all is the ultimate step in equity. And that's what that was really the mindset of trying to set up, equitable standards so that everybody would have the same resourcing and the same capabilities once they're introduced into the field. So equality, and the other issue that comes up a lot that people can think of as a virtue is this concept of colorblindness. And I'd like to just knock that on the head. Colorblindness is not a kindness. My view is that calling yourself colorblind and insisting on treating everybody exactly the same, no matter their background or the color of their skin, is a stubborn denial of intersectional disadvantage. And if you are colorblind, you are in fact intentionally disadvantaging people that the world imposes an enormous amount of disadvantage on. And so you need to be aware of these levels of discrimination. And Australia still has racism issues, has very significant racism issues. And to deny the existence of that simply because one hasn't experienced it oneself is a denial of the lived experience of others. And that's not okay in any form.
Indeed. Can we talk a little bit about leadership? A lot of doctors say all doctors are leaders.
Ugh.
I meet many doctors who don't know what that means, who don't know if they want that role, who, are confused, I would say, about what that is. I meet many patients who say, I don't want the doctor to lead me. I want they to collaborate with me or see me like I'm a normal person. And then I meet many trainees, which we're talking about, bullying and harassment and so on, who also feel like, well, if that's the kind of leader that I'm expected to be, I don't want to be a leader for some of the people who are teaching them. So to me, it seems a much more complicated matrix than all doctors are leaders. And from your reaction, it seems like you've had something interesting to say. Can you share with us?
We are obsessed with the idea that leadership is the only worthwhile destination.
Mm,
And
mm,
I think that and it's just crazy because if everybody's leading at once, then it's just a bit of chaos. So I think that this idea that leadership is something that everyone should aspire to, I think that's silly. But the flip side of that is that actually everybody leads something.
Even if it's
Unless they're still a babe, even at kindy level, you'll see kids influencing other kids. You'll see kids deferring to another child, asking their opinion. So we see leadership emerging unintentionally in various contexts. And the patient before you might be a leader in their local volunteer organisation. They may be a leader of their own family. So I think this distinction that all doctors are leaders, well, yeah, but only to the extent that all people are leaders. It's not something that medicine magically confers on you. And I am very much of the view that yes, there can be individuals who, through formative experiences, grow up with what people label as natural leadership traits, but often are just the result of circumstance, education, role modeling, etc. But leadership can be taught. It's a helpful skill set to have, good leadership, but it doesn't have to, you're not a failure if you don't want to be a director. You know, it's perfectly fine. Look at me in the end of my career. I'm happiest in an emergency department, just cracking on treating the patients because it feels like very high value work. And I don't need to be leading anything in that context and in that environment. So I think that that statement is wrong. It sets us up for failure. I think doctors do a far worse job systemically of growing people in management and leadership capability than nursing does. Nursing has managed to develop a very nice and cumulative career path that grows people into leadership and management roles, whereas medicine kind of just throws people in and says, well, all doctors are naturally leaders, so just crack on and do it. And that can be a very bruising experience.
Maybe I have a particular subset that I work with, and that's probably true. But I think a lot of people in head of unit and head of department positions, everybody stepped back.
Absolutely. I
So
learned that lesson in my year 10 school rebellion. They were with me until they weren't.
yes, exactly. And there's a lot of people come to coaching for succession issues. I'm the head of department and I'm trying to cultivate or develop people to step into the role after me, and I'm finding it very difficult. Nobody wants to, or I can't get people to meet with me to talk about that kind of thing. There are multiple different issues. I don't want to make that one issue, but that's a very common theme that people come to coaching for, to say, how am I going to help the people in my team become the leaders of the future? I was interested, you said you're doing some work around that, mentoring some people into
Mm.
future positions. Do you want to talk a bit about that and a little bit about your new consulting so that people know?
Oh,
Um,
sure. So, so I think that when one is having difficulty growing the next set of leaders, it's often because the leadership models that they've seen don't resonate. I remember when I got to the UN, there was an initial really aversive response from the staff because I wouldn't tell them what to do.
mm,
And it would have been really stupid of me to tell them what to do because I didn't know the business, I didn't know the people, I didn't know the culture, I didn't know anything. I was having my very own, you know, nothing Jon Snow moment. It was just like, but there was a very fixed idea that the director should direct. But my approach always has been listen, 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 the solutions come. And even that very famous medical quote, the patient will tell you the diagnosis if you but listen.
mm,
And so I think that for many people, understanding or being able to identify the strengths that they have, that they can use in leadership, to not have to become some fake version of themselves, that by learning to leverage the strengths that they have, they can become the leader that their team needs. I'm a huge fan of strengths-based leadership development. I am now a vocal opponent of 360-degree feedback methodologies. There's very good evidence that they systematically disadvantage women. Women get less actionable feedback, more emotionally loaded feedback, more judgmental stuff. Men get actionable things that they can actually do something about. And so I had the privilege of completing a leadership course at Yale, and I was introduced to a fabulous tool called Reflected Best Self, which is, I can't remember where it came from. It's one of the American states. But it reaches back through time to people who've known you right from, you know, high school through. And you just ask them to tell you about what they thought was best.
mm.
And it's an
Interesting.
amazing experience.
Mm.
And it helps you revive the things that might have been extinguished by this constant barrage of you have to become more like Fred or John or, you know,
Mm.
what is it? More Davids at the leadership table than there are women.
Yes, that's right. Um, just for our listeners, we will try and put most of these things that Jillann's referring to. We'll certainly put the better culture reports and so on into the show notes, and maybe you can send me something about what you've just said.
Reflected best self, because it is, it's actually something you can do yourself. You don't even need to hire someone.
I'd really love to have a look at that. We've just started, actually. We haven't been doing 360s in our coaching work for a long time, but in the last 2 years, we really have started doing quite a lot more of them. So that's also interesting to me, what you've just said
Yeah.
about that in terms of that research. When you think about going forward, I know that you're thinking about retiring for yourself in the coming years, but when you think about medicine going forward, a better culture, these ideas that we've just been talking about, leadership, metacognition, opportunity for people to step in and out of their clinical work, what's the future vision of medicine and health look like for you? Pick any time frame.
Well,
Two.
the big future of medicine and health for me is as a consumer. I'm going to be I'm going to be on the receiving end of the tender care administration of the colleagues that I may have helped to train. It feels hackneyed, but we're at a real inflection point at the moment with there's an intersection of many things. One is the general loss of community trust that has permeated the world since COVID. I think there was a lot of harm done through conspiracy theory, through perhaps imprudent and hasty advice. I was part of that. I was doing the best I could with information, but there was an erosion of trust. And then there's been the amplification of the village idiot in the square being given as much kudos as an erudite scholar who's been studying something for 50 years, and the public doesn't, by and large, seem to be discerning terribly much between expert advice versus a blogger who's trying to sell a product. And I think that we are at a real inflection point where that competing with misinformation and disinformation is a really critical thing that medicine and the health professions generally need to do. And we need to stake that territory out very clearly and be prepared to assertively challenge people who are engaging in unregulated conduct, because you can do whatever you like. If you're not a registered health professional, you can get out there and it's subject to consumer laws, you can harm people. So I think we need to do much better at helping the public navigate the minefield of disinformation that's out there at the moment. As a profession, we have no choice but to work in the AI era. We've navigated the Google era. I was, never too worried by people coming in with their Google search. It let me know what was actually on their mind.
Yeah.
This is what you're actually worried about. Let's roll our sleeves up and deal with this. Now people are coming in with an AI workup sheet. I did that to my own GP a few weeks ago. Why shouldn't I behave like any other patient?
Yeah.
And I think that we need to be agile in adapting to the persisting challenges, whilst remaining, staunch advocates for the importance of a human connection in medicine. I feel that some areas of work are going to feel the squeeze as AI models become more and more sophisticated. But the need for people in distress to connect with humanity is not going to go away. That's not going to go away. And so I think the, cultivation of what get called the soft skills, but they're actually the hard skills of connectedness and empathy and an ability to move out of your fully medical brain into the space that the patient inhabits, even temporarily, to understand their concerns and the barriers that exist in the life that they walk. That's what will allow us to create value in the future.
Mm. And Jillann, you've talked about walking with people in Central Park and learning about intersectionality and so on. You're
Yeah.
so reminding me of some of the women that I've worked with who've taught me that. It was a client who taught me even the word intersectionality a few years ago. And so, we just learn so much from each other in these ponderous kind of moments where we're open to learning. I think they're so valuable. Who helps you? Have you had coaches, mentors, supervisors, teachers that have been
Oh, I couldn't, I wrote a little post in LinkedIn a couple of weeks ago about, how grateful I am for the education I had. And I started writing and, wanting to give shout outs to all the people who've grown and nurtured me over the years. And it just turned into an Oscars speech. So I just culled all the individual mentions and went with the system level things that had helped me. I can't even begin to name the people who've backed me, who've taken a risk on me, who've been prepared to let me grow roles into my strengths. And I think that's been one of the key things in my own career, is to take a job that might not be exactly what I want, but recognizing a need and then growing the role to fit my strengths and to fit what feeds my passion and helps me deliver with passion. That's been a wonderful privilege that I've had in a succession of jobs where I've been able to grow things. So, for example, at the UN, I was basically hired to approve sick leave and disability claims. That's what they thought the job was. But I got there and I discovered that there was an entire healthcare ecosystem that was not operating with the normal disciplines of a modern healthcare system. And so I set up a public health unit, I set up a credentialing and standards unit, I set up, a number of things that allowed us to modernise. And of course, that was done with, the support of my boss, but the blessing of the member states eventually, because the UN doesn't exist but for the approval of the member states. So there is the skills of finding the people who will let you be yourself and let you leverage your strengths to the advantage of the organisation. There's then also the skill of being able to convince them to do that and, to generate belief. And I definitely learned a lot, through professional education opportunities. I have always had sort of peer relationships. Relationships outside medicine are incredibly important for keeping you grounded. My husband is a medical researcher who I don't think he'll mind me telling this story because he does tell he got a full scholarship to Oxford. So bright young man, and he could choose any discipline he wanted to study at Oxford. And he was contemplating medicine. And he went around and spoke to lots of doctors. And after talking to lots of doctors, he said, "There is no way I'm studying medicine. They are the most miserable group of people I've ever met."
Mm.
And so he went off to university, and this was in England. It was, and so he went off to university and studied his passion, which was science, and went on to have an amazing career in science. But he has kept me really grounded in the fact that there are people and worlds and problems that sit outside of medicine. And I think he's been a really powerful influence on my worldview as well. I think it's really important to cultivate non-medical friends, and I think that was definitely one of my early strengths was stepping into that student union space so early. I went off into the student union space dealing with all of the students of the university. Quite a number of my colleagues followed the more traditional pathway of going into the Medical Student Association and then the AMA. And so, if you stay within that medical ecosystem, you can fail to gain the benefit of that enormous breadth that sits in the world.
I think your stories are full of that, where you could see contrast. There was
Very much
contrast.
so.
Yeah. I can't let you leave. I know I asked you already, but please tell our viewers where you are because they'll want to know what the photo behind you is.
Oh, yeah. So this is the Wynnum Wetlands. One of the other ways I keep myself sane is just lots of activities. And so kayaking is one of them. And this is the Wynnum Wetlands, and this is a really beautiful area that you can paddle into that almost has a cathedral-like feel. You paddle in, and the branches of the mangroves are arching over from both sides, and you can paddle all the way up here, and it's quite a spiritual experience to head in there. And I definitely do recharge in nature, so I can tell you a campsite that you can be pitched in less than 2 hours out of New York, where I spent many a weekend. Me and my dog and my tent. So getting out into nature is definitely part of my recipe for staying sane.
Sounds fabulous. I'll need to ring you up in a few years and say, Jillann, I'm in New York.
It's the campsite.
Thank you so much for your time today. Everything we talked about could be another hour by itself, and I really appreciate you crossing a lot of terrain with me in this time that we've had. I hope that if you're listening, that you can hear the twists and turns in Jillann's career and her work, and also the kind of steady threads that run through all of those twists and turns, her commitment and values and clear clarity and focus about what she's trying to achieve and who she's trying to connect with are evident, and her openness and her willingness to find lots of different ways to keep life interesting for herself, but also to continue that work. And we haven't really been explicit, Jillann, in saying about you stepping in and out of clinical work, but maybe we can just finish with that bit, that this encouragement for people that taking a different turn, doing something else for a while, doesn't prohibit you from coming back to clinical work, and that these
It does not.
can live together.
It does not. And I think that I've stepped in and out clinically on multiple occasions through my career. The biggest break I took was when I went to New York, and I was over there for 8 years. And before that, I had not worked clinically for a couple of years. So coming back to clinical work after sort of a 10 or 11 year break was the biggest one I've done. But I can say authoritatively that it can be done. And a lot of people are put off by the medical board's requirement for supervision if you've been out. And I just don't think that that should worry people. I think that it's a relatively painless process. It just requires a bit of humility to accept that this is for the sake of patients, but also for your own protection. And I think that it has definitely helped me avoid burnout because I will bounce through the emergency department in my 60s without a hint of burnout. That I don't think I would be like that if I had stayed in the front lines for the full, 40 odd years of my career.
Mm, mm. That's a beautiful place to finish. Thank you so much for your time, Jillann. Dr. Jillann Farmer, everybody.
Thanks, Sharee.
Thank you for listening. I look forward to sharing our next conversation with you next week. And in the meantime, may you be well. The content in this podcast is not intended to constitute or be a substitute for professional medical or psychological advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified healthcare professional. This podcast represents the views of the hosts and guests and do not necessarily reflect those of any entity we work with or for.